I am Dr. George Augustine Koromia, and welcome to this edition of the Pocket Program. I am an advanced imaging multimodality cardiologist here at the Firelands Physician Group Cardiovascular Center. Today we'll be speaking about sex differences in cardiovascular disease. Now, cardiovascular disease remains of global concern, despite the fact that women typically have a lower incidence of CVD than males. A number of studies have shown that after an acute event, women do have a greater rate of death and a worse prognosis. This is due to the false assumption that women are more protected than males against cardiovascular disease, and thus the risk of CVD is often underestimated. This leads to less aggressive treatment, as evidenced by lower rates of guideline-based diagnosis and less invasive treatment for myocardial infarction. Unfortunately, many patients often lack the awareness of their cardiovascular risk, and healthcare providers may sometimes fail to adequately inform them of this risk. Now, sex and gender differences are due to epidemiology, pathophysiology, and treatment response that are different in men and women. In addition, social and environmental factors such as smoking rates, nutrition, level of stress, and activity do add to these differences. Adding a gender dimension to biomedical research has increased our scientific validity and applicability of the therapies that we provide. Women on average develop cardiovascular disease later than men, and hormonal changes, particularly with estrogen, impact vascular health and contribute to coronary artery disease risk. And coronary artery disease is the primary cause of cardiac-related deaths in both men and women. However, women tend to live longer. Hospitalizations for heart failure and stroke are more common in women, and it's also the case that women tend to have a higher incidence of what's called heart failure with preserved ejection fraction and non-ischemic cardiomyopathy, which is usually seen in older age. Now, premenopausal women exhibit lower rates of hypertension and better lipid levels. However, this reverses with age, and so menopause does increase the risk of hypertension and hyperlipidemia. Uncontrolled diabetes worsens cardiovascular outcomes for all patients, men and women, but risk factors such as smoking have a greater negative impact on women, even though it's more prevalent in men. Depression, sustained internal stress, and anxiety also contribute to cardiovascular risk and is more prevalent in women. And certain conditions are gender-based, such as polycystic ovary syndrome and cardiovascular diseases related to pregnancy, which only happen in women. These are linked to unfavorable cardiometabolic profile and impact cardiovascular health. The prevalence of non-obstructive coronary artery disease, microvascular disease, and coronary dissection is higher in women than in men, although the rate of obstructive coronary artery disease that commonly leads to myocardial infarction is more common in men. This can lead to atypical symptoms between men and women, which should be recognized. Prompt and aggressive treatment is needed, as this contributes to significant morbidity if these are not addressed. If any of this has been of interest to you or raises concern, feel free to give us a call and schedule an appointment here at the Firelands Physician Group Cardiovascular Office. I'm Dr. George Augustine Koromia, and I thank you for watching this Pocket Program.